All right, good morning, folks. This morning, we are going to be taking up H46, which is an act relating to the Rare Disease Advisory Council. Just as a reminder, that was the bill that when we did our little poll here in committee, that was the only one that got multiple votes, more than two. And so that shows us what a wide variety of interests that we have in our committee. But in this one in particular, for people who were here last year, we began some testimony last year, not on a bill particularly, but just to start to understand the issue a little bit, because we were receiving a number of requests to take up the bill, but it was at the end of the biennium, and we had other things that we needed to get done before crossover, so we did not do it before crossover. But the committee took some testimony on that at the end of last year. So this is the beginning of a biennium, and so we will be able to carry this forward into next year. And we are welcoming Kelly Dougherty from the Health Department here. Good morning, Kelly. Nice to see you again.
Morning. Nice to see you all.
So we are interested in the health department's perspective about this. And, one of the things that, you can have the floor, and then we have some questions about current federal activities in this area. And, I think maybe the importance of this council has taken on additional importance this year. So not that it wasn't always important, but it's I think becoming even more important.
Right.
So if you could give us your thoughts, the health department's thoughts about this, that would be great.
Yeah, I actually have some slides with an overview of the work that the health department does in this space.
Oh, great.
Already, and then I can speak to the bill specifically after that, if that works.
Thank you. That works perfectly.
Okay, and bear with me. My external monitors are not working, so I'm dealing with a tiny little laptop screen. So once I share my screen, I will not be able to see you.
Okay, and then please make sure to send it to Lori.
Yes.
Afterwards.
If we could get it sooner rather than I can't see the screen.
Oh, okay.
The big one, so I can't follow along. Just
if you could send it to Lori while you're figuring out.
Blocking.
Yeah, actually.
You can do that. Okay.
Yeah, Natalie can do that. Thank you.
Natalie's on it. So.
Natalie's gonna save the day.
All right.
So hold on one sec. It's really, you get so spoiled with two screens or with three screens that it's hard to function when you don't have your monitors. So hold on. Okay, here we go. Are you seeing my slides?
Yes. Yes. If you're not in the slideshow view yet, but
okay. Now
there you go.
Okay, great. So thank you for having the health department here today to talk about this important issue. So Act 164 of 2024, as I'm sure you know, requires us to describe the public health impact of rare diseases in Vermont and our role in addressing rare diseases statewide. So rare diseases, the National Organization for Rare Disorders defines a rare disease as a disease, disorder, illness, or condition that affects fewer than 200,000 Americans. There are over 10,000 rare diseases that together affect more than 30 million Americans. And some of these rare diseases include types of cancers, many types of birth defects, amyotrophic lateral sclerosis or ALS, and many other diseases, anomalies, and conditions. And this is just showing sort of the kind of public health and medical model. So public health really functions at the bottom two areas of the pyramid, maybe a little bit into the third. And then above that is really the healthcare system rather than public health.
And Kelly, back on that last slide. In terms of public health and rare diseases, so when we think about rare diseases, we think about them, as you just said, affecting smaller numbers of people than, let's say diabetes or
Right.
heart disease or breast cancer, things like that. Does the public health approach change for rare disease, for sort of for the myriad, I guess, of rare diseases? Is the public health approach different when we talk about rare diseases?
No, it's as far as public health, really our role is screening and data collection, collaborating with partners. So making sure that as we are screening, let's say newborns, that we can direct families to the appropriate resources so that they can get the care they need. And then also disease promotion and health promotion. So even though many rare diseases are the result of genetics or other things, there are some that, for an example, like alcohol use in pregnancy can cause birth defects. So, working on sort of those things that can be prevented. So that's very similar to the role that we have in other types of diseases.
And so I guess you talked about screening, particularly in children, in young children, infants. And so what impact is the federal administration's essentially termination of the advisory committee guiding states on newborn screening?
Yeah.
What impact is that going to have on the types of screening that we see in the future, the types of screening that we know about now, the data collection that you talked about? What kind of impact is that going to have?
I don't think we know yet. So we do know that the advisory committee, like you said, on heritable disorders in newborns and children has been disbanded. The Office of Birth Defects, the office that addresses birth defects at CDC, has either been eliminated or severely cut. And we know that the newborn hearing screening program is looking at cuts, but we don't know exactly what that means yet. And this is across the department in many different programs. For example, our pregnancy risk assessment monitoring system, which is a program through CDC, their entire staff was let go. The office was closed, but then we got a notice of that we were getting our grant award just last week. So it's very confusing. We don't know what's going on. But, as soon as we do, certainly we will keep you all informed as things develop at the health department. We're just sort of like on the edge of our seats, wondering what's going to come next, unfortunately.
And so is it safe to say that the health department in Vermont, that we have not changed any of our practices as a result of the changes that are happening at the federal level? So we're still screening for the same conditions, diseases, disabilities, all of that. We're still doing all of what we've done.
Exactly. Yeah.
Okay. What would happen, however, you said you just got notification of your grant award. If there were significant cutbacks in those grants to states, what would be our response, or what would we need in order to continue to do that work?
Yeah, that's a great question. And actually the PRAMS that I mentioned is separate from this work around rare diseases.
Okay.
But we are sort of doing a lot of planning internally right now around, what are the things that we have to do either by statute or because they're critical public health functions. And
Mhm.
as we learn about different grants, so far, the only ones that we have heard about are the three that were terminated on March 24th. That was an immunization COVID related supplement, a laboratory supplement, COVID era supplement, and our health disparities grant, as well as an environmental justice grant in our environmental health division. Those are the only ones we've heard of so far. Fortunately, the three that were on March 24th, we already knew that they were going to be ending eventually. So we were able to, some staff loss was just due to attrition. So as people left, we didn't rehire those positions. So the impact is not nearly as great as other states who have had to lay off like hundreds of people. So, but we are developing a process by which, as we get whatever news it is, here are the things that we're going to look at. And then we're just going to have to figure out, are there other funds that we can shift around to cover those duties? Are there things that we're just going to have to stop doing? And there's just so much uncertainty right now that it's hard to predict. We're obviously we would not be able to keep doing everything that the health department does right now if we saw massive cuts.
Right, right. And I
Yeah.
understood from AHS that it looked like with the loss of the grant funds that we knew we were going to end later this year, that it looked like most of those staff would, as you said, either not hired and through attrition, or they have
Yeah.
been redeployed in the health department. And there might have been, I think at the time when I heard, there might have been two potential layoffs or two FTEs. Is
Yeah,
that still?
we're still kind of figuring that out, but it won't be a significant staff loss. But
Okay.
I do want to highlight that, particularly for the health disparities grant, a lot of community organizations, even though their grants they knew were going to be ending, these are small nonprofits, and to suddenly have their funding just end unpredictably is really challenging for them. So I don't want
And
to.
like, what kind of organizations were those, Kelly?
So, in the health disparities world, organizations that are serving new Americans or Indigenous Vermonters, or doing health equity work in the community around sort of like outreach and things like that. So
Okay.
I believe there were 14 grants that were impacted by that sudden cancellation because it was effective immediately.
Okay.
We backfilled for like a week and a half so that they had time to they could submit invoices and we could pay them for the work that had been done through the 24th. But it still, is challenging for small organizations to sort of pivot quickly
Yeah.
like that. So
Yeah,
I don't want to discount the impact in the community because it's not just on the health department.
absolutely. Thank you.
Mm-hmm. So across the Agency of Human Services, there's work on rare diseases. So the health department has the bulk of it. We have the Vermont Birth Information Network, our Children with Special Health Needs program, our newborn screening and hearing screening programs. We operate a cancer registry and an ALS registry. The Department of Vermont Health Access, has provider resources and clinical programs. And then obviously our Department of Disability, Aging, and Independent Living plays a role as well. So I think I covered this already, but our role in addressing rare diseases is really around screening and data collection, connecting families with supports and services, and like I said before, disease prevention and health promotion. And like I said, most rare diseases are not preventable, but there are some areas where we can promote healthy behaviors to lower risks.
Do you notice, Kelly, any, because these diseases are so rare, are there issues, or do you hear about issues for individuals or families with insurance coverage, whether it's public insurance like Medicaid or
Mhm.
private insurance like MVP or Blue Cross?
I'll have to ask our staff in the screening programs, as they're connecting people with resources, if that's an issue. I have not heard that. But let me follow up with them, and, kind of get the lay of the land on the
Okay.
insurance question.
That would be helpful just because, because of the rareness of the condition or the
Mhm.
disease, I can imagine that, especially if there is early intervention work that could assist in optimizing quality of life for people, that might be more difficult to access because of the rareness of the disease or condition. Yeah.
Right, exactly.
Okay, thank you.
So in our data collection, screening, and surveillance sphere, so, collecting data on diseases and health risks and behaviors is sort of like the bread and butter of public health. So these programs within the health department help us understand the impact of rare disease in Vermont. So we have the newborn screening program. So, newborns in Vermont, there's a dried blood spot test, and newborns are tested for 33 conditions, not all of which are rare diseases, but some of them are. We have the Birth Information Network, which is a registry of select rare diseases. So like birth defects and congenital conditions. So these are also affecting infants, so these aren't things that happen to people later in life. And in in statute, sorry, there's it includes medical claims data and vital record information. We have our cancer registry. So every physician in Vermont is, as they diagnose people with cancer, they are to report per statute to our cancer registry. And again, not all of those cancers are rare diseases, but some of them are. And then in 2022, I believe, Chapter 4A of Title 18 created a registry of ALS diagnoses in Vermont. So physicians who diagnose patients with ALS are to report those to the health department.
So on the Birth Information Network, where it says medical claims data, is that medical claims data for all insurers or only Medicaid?
I believe it's all insurers.
Okay.
I'll confirm that.
Okay. And so is there information that's required to be reported by pediatricians or other healthcare providers? Or is that, I'm just wondering because it references screenings. So is there something that the data system is reliant upon reporting from medical providers?
I believe so, and I apologize, this is not my primary area of expertise, but the Birth Information Network would include anything that was discovered through the newborn screening program. If it is a rare disease that is covered by the Birth Information Network, but the Birth Information Network, I believe, can also include other reports that did not result from the newborn blood screening.
Okay. Thank you.
So the newborn screening program, like I mentioned before, is screens newborn babies for diseases and conditions. And the goal is just to identify them early so that people can get connected to care. So it's not just the testing, it's the follow-up, and following up on referrals, and that they get education and all of that about the disease and what the care plan is. So the panel is actually determined by a group of national experts called the Advisory Committee on Heritable Disorders in Newborns and Children, which is the committee that was disbanded.
Yeah.
So, but the panel obviously still exists based on their prior recommendations. This is statewide, the birth information network.
Sorry, Kelly, we have a couple of questions that just
I'm
popped
sorry.
up. So, no, that's all right. They just went boom, you know, up in the air. So Representative Bishop and then Representative Eastis.
With respect to this National Count Advisory Committee and otherwise, are they establishing that list of 33?
Yes.
Okay.
Yep, they establish sort of the disease, the uniform screening panel
Thank you.
for state.
Don?
Same question.
Same question. Okay.
Okay. The birth information network, like I said before, it's sort of population level surveillance of selected birth defects and other congenital conditions. And, you know, we work in partnership with environmental health to explore, you know, are there environmental or chemical impacts or exposures that is having an impact on these health conditions. And then we share data with local and national partners. So the Vermont and National Environmental Public Health Tracking Programs and the National Birth Defect Prevention Network. So it's really an effort to, like, you know, really get kind of the population level impact of these diseases. So it's less about working with families and connecting them with care. It's really at the population level so that we can kind of see what the trends are and monitor those.
I would imagine that, you know, things like geography play into that. So, you know, are there more cases of a certain condition in a certain part of the country, for instance? And are there things like that that impact? So I guess a follow-up question to the disbanding of the advisory committee. Are you seeing anything? I shouldn't even ask about on the horizon because it's so difficult to predict anything. But, you know, the two things that you cite here, the National Environmental Public Health Tracking Program and the National Birth Defect Prevention Network, are those things, when you say national, does that mean that they're run by the federal government, or is that, yes?
Yes.
And have you seen any indications that those will be discontinued?
I haven't heard about the Environmental Public Health Tracking Program. The National Birth Defect Prevention Network, I'm not sure if that's a government entity. I'll have to check on that. I don't know if Natalie, if you know in the room, but
Shaking your head no.
okay. So we'll add that to the list to follow up with you on. But again, just like everything across our department, that you know, we've had so many things close and disband and haven't gotten any information on what that actually means.
Yeah. Like I can just imagine something that has the word environmental in it could be at risk.
Yeah.
Even before somebody knows what it is.
Exactly.
Yeah. Go ahead, Representative Steady.
So Act 46 do you think that would be more of a burden for your department, seeing you're already supplying the data?
In a nutshell, yes.
Yeah, I thought so too.
So to the extent that, you know, our funding allows, we're going to continue to do all the work that I'm talking about here. But the creation of a council would require resources, and there aren't any resources.
I was thinking financially.
In the bill or in the governor's budget, you know, for staffing support for the council, for reimbursing council members, you know, for travel, those kinds of things. I mean, we would welcome the opportunity to participate in such a council if it existed, but to have the health department run it, we wouldn't have the resources to do that, especially given all of the uncertainty at the federal level.
Yeah, I was very concerned about the financial burden and the burden on the department.
Yeah.
Thank you.
Mm-hmm. So there is some overlap between the newborn screening program, the BIN, the Birth Information Network, and rare diseases. So we collect data on about 115 conditions and diseases through both of those programs. And like I said before, some of these conditions that we screen for are not necessarily rare. And that's not really their purpose. The newborn screening program and the birth information network to be a repository for all rare diseases. But rather it's to find diseases and conditions early, so that people can get the support and care they need. And I think I said this before, prompt referral to specialists and education and those kinds of things. So although some of the diseases that we collect data on are rare diseases, that's just a subset of what's in there. So here's some examples of data from the Birth Information Network. So from 2018 to 2022, 4% of the 26,000 plus infants born to Vermont residents had one or more conditions monitored by the Birth Information Network. And structural and chromosomal birth defects were the most common. There are hyperlinks in the presentation, so you'll be able to go and see the data and also like the conditions that it screens for. So there's a lot more information that you can find on our website, which is linked throughout this presentation. The cancer registry, like I said at the beginning, some cancers are considered a rare disease. Our cancer registry tracks every case of cancer among Vermont residents and any case diagnosed in Vermont. And healthcare facilities are required by statute to report that. Also including benign brain-related tumors to the cancer registry. And again, there's a link there to our cancer data pages if you're interested in learning more. And then the ALS registry, ALS is considered a rare disease. Act 149 of 2022 requires healthcare providers to report all diagnoses of ALS patients to the health department. And in 2023, there were 27 Vermonters who received an ALS diagnosis, which that felt like a lot to me. I don't know if you all feel that way.
I think Kelly, I think frankly, that's why we instituted the registry, because we did not have that kind of data prior to this. So while it wasn't something the health department was particularly fond of, we believed it was necessary.
Yep. And then I talked before about partner collaboration. So our Children with Special Health Needs program, they support children and youth with many complex chronic health conditions and developmental needs through Medicaid administered programs and community support. If somebody is reported to have a condition that is part of the Birth Information Network, parents receive information about how to connect with our Children with Special Health Needs program, so they can get connected to care. And those services are available until the person is 21 years old. So we have social workers, nurses, and specialty staff with experience supporting children with special health needs, across the state. We have folks in our district offices through the CSHN program that work in their local communities to help connect people with resources. And then disease prevention and health promotion. So I gave this example before about most rare diseases are not preventable, but some are. So this is just an example of work that we do to try to prevent birth defects through alcohol use during pregnancy. And fortunately, it is decreasing in Vermont, but it's not as low as we would like to see it.
Kelly,
Mm-hmm.
can you tell us how that compares to nationally?
Yeah, I'll have to send that to you. We typically, and this only goes to 2022, but Vermont is usually above the national average for alcohol use and smoking during pregnancy. So we're really trying to work on that.
Thank you.
Mhm. And then here's just some resources, in addition to the health department links that are embedded in the proposal. You can connect to these outside resources, like the National Birth Defect Prevention Network, et cetera. And I'm happy to take any questions.
Thank you. That was very helpful, Kelly.
Mhm.
I did just happen to link, thank you for the link to the ALS report. It's actually some pretty interesting information there, and I realize it's too early to make any judgments about it, but I think that part of why people were advocating for things like this registry and for this advisory committee on rare diseases is because sometimes when our numbers are so small, when we look at CDC reports, it can misrepresent what is actually happening on the ground in Vermont.
Right.
So seeing information about what's actually happening on the ground in Vermont, I think is important. And so I look forward to continuing to have that updated data as people, as physicians and other healthcare providers in the department sort of looks like you're going to modify the form somewhat. I'm presuming that's because you had feedback from providers or thought that there were things to go. Yeah, Natalie is a lot of shaking the head over here. Natalie's shaking her head. Thank you for that. Okay, so let's open it up to some, and thank you. That very much was what we were expecting in terms of the 2024 data. Requirement in the language in the bill that was passed. So thank you very much. So let's look at the bill for a second. Representative Steady sort of led us off in our questions about that. We obviously, I'm sure you're familiar with, we're getting quite a lot of advocacy on wanting to establish a rare disease advisory council in Vermont. And I'll be honest, it seems even more important right now to do so, given the actions of the federal government is taking to dismantle some of the resources that states have relied upon in this area. Other than, do you have any other comments about H46 other than the ones that you did in response to Representative Steady?
I guess I would just reiterate that right now is a particularly challenging time, given all of the uncertainty at the federal level and sort of, things we're hearing around potential cuts. And that supports, as the majority of our funding is federal. And so it is, it would be challenging to take that on at a time when we could really see a real reduction in our staff. And I would hate for the community to have expectations that the department would do any additional activities or follow up on council recommendations, given the current state of federal funding and the lack of funding in the bill to support the council.
And so if we decide to move forward with this bill, what we would appreciate if you could provide an estimate on what the cost of the council would be in terms of skip that. I'll ask JFO for that information. Okay. Make it consistent with other councils. So we recognize that there would be a cost. And at this point in time, I don't think I would feel comfortable saying, that cost would be borne by the Department of Health's existing resources, given the uncertainty of, what's happening. If we decide that this is something that the General Assembly feels strongly enough about, then I think that we would have to figure out how to pay for it.
And also, just to, as you know, we don't have a new commissioner yet, like a
Yes.
permanent commissioner. So we're on a commissioner search, and whoever that person is going to be coming in and sort of, you know, having a lot to learn and lead and, you know, all of that. So just another piece of context.
Sure, thank you.
Mhm.
Do you have any suggestions about sure. Do you have any suggestions about the composition of the council?
No, I mean, I think that the composition is, it looked, you know, pretty comprehensive. And like I said, we would, if the advisory council was seated somewhere else, we would be happy to participate in it. But I didn't see anything that was missing. I'll say that.
I was wondering about Dale, since that department's responsible for supportive services for people who are Medicaid eligible. I thought Dale should be probably added
Yeah.
at some level. And you know, you said seated someplace else. Do you have a suggestion about where that would be?
I do not. I don't know
Yeah.
if the you know, healthcare provider community, or, you know, I don't want to throw out organization names, but it's, you know, it seems like maybe a healthcare entity might be appropriate for something like this.
It's an interesting concept. Yeah, go ahead, Representative McGuire.
What about a university entity like the, yeah.
Medical
Yeah,
school.
medical school.
Oh, the medical
School.
I think I'd prefer that over a provider organization.
Yeah.
Yeah,
And
okay,
providers would like be able to handle it either, so.
yeah. All right, interesting. Okay. Other questions for Kelly? Yeah, go ahead, Representative Cole.
Thank you. This might be sort of a research question for later, but I'm curious about if you happen to know what percentage of diseases you track require immediate medical intervention. Versus, I love that there's this network of very long-term care, which is a really important aspect of this, but I am curious about like the immediate consequences of finding out about some of these.
Yeah, I don't know the answer off the top of my head, but we could look into that. I know that there are some, you know, diseases that are diagnosed in newborns where they really need immediate
Yeah.
Intervention, but I don't know what percentage that is, but we could look into that.
Thank you.
Mm-hmm.
And I just want to recognize that we've been joined by Carolyn Sheridan of the National Organization of Rare Diseases. So good morning, Carolyn. We can see your face if you want to pop on. Good morning. Thank you. Carolyn, I actually do have a question for you. So in other states where this has been established, we just heard from the health department that they'd be happy to participate, but would prefer that it be located in a different organization. So do you know nationally in other states that have these advisory committees where they are located?
Yes. So right now I kind of say that there are about 25 active councils. There are 30 established, but the rest are in various states of being and appointments. And by far the most common housing entity is what we call it, are public health departments. About 22 of them land within a health department. The next closest is going to be kind of like university medical systems. About 5 of them are housed within that. And that was actually much more common when these were being established prior to 2020 to see the universities take them up. I think with COVID, there was an influx of funds available to state health departments to be able to do initiatives like this. So that's when the RDAC stuff really picked up. So I think that is why we saw them landing in health departments. But before that trend, it was largely universities that were putting these together.
Well, we might be reverting back to that.
We just
So-
did in Mississippi. They were signed in 2024 through University's Medical Center.
Mhm.
Hmm.
Okay, thank you. That's helpful. Okay, any other questions for Kelly this morning? Thank you very much for the report, Kelly, and
Yes.
your sphere of knowledge, I'm sure, is broadening by the moment as you're called upon to do many things. So good luck keeping your head above water and all of
Thank
that,
you.
and thank you for being here.
Sure, and we'll be in touch with those follow-up items.
Okay, thank you.
Bye-bye.
Bye-bye. Okay, so next, do we have either of those witnesses?
We have, at 10 o'clock.
Okay. All right. Okay, all right. Let's, because they're 15 minutes late, and we're 15 minutes late. So, I'm sorry, sir. What's your name?
I'm Leslie.
Leslie, okay. Okay, if you want to go first, we can, while we're contacting the other witnesses, that would be great. So, join us in the hot seat at the head of the table.
Oh, it's not warm.
It's not
I'm looking forward to that one.
No.
Actually warmed by our last.
I got it.
Yes. Thank you for being with us, Dr. Kanat.
Kanat.
Kanat, okay, Kanat. We'll just do a brief introduction so that you know to whom you're speaking,
Thank you.
since this is your first time in our committee. My name is Teresa Wood, and I serve the communities of Waterbury, Bolton, Beals Ford, and Huntington.
And Donahue from Northfield, also for Berlin.
Good morning, Dan Noyes, represent Wolcott, Hyde Park, Johnson, and Belvedere.
And good to see you again.
Hi, good morning, Representative Eric McGuire, Rutland City.
Eric.
Doug Bishop from Colchester.
Doug, hello.
My name is Zon Eastis. I live in Guilford and I also serve Vernon.
Zon, okay. Zon,
Yeah, Zon.
Hi, I'm Esme Cole and I'm from Hartford.
Esme.
Hi, I'm Jubilee McGill. I'm from Bridport, but I also represent Middlebury, New Haven, and Weybridge.
Hi, I'm Ray Garofano. I live in Essex and I also represent Essex Junction.
Lori, Forest Committee Assistant.
Natalie?
Introduce.
Natalie Weil, I'm a policy advisor to Department of.
Hi, Natalie. Thank you for having me today.
Thank you. Welcome, and we'd love to hear your comments and perceptions about establishing a Vermont-based Rare Disease Advisory Council.
My pleasure. Thank you for having me. I appreciate the invitation. My name's Leslie Kanat, and I live in Jericho, Vermont, with 2 children. I started teaching geology on the Johnson campus in the late 1900s, and oh yeah.
Oh, I know I did.
I resigned in 2020. It was a tenured position. I was a good instructor. I know I was good, but I wanted to be home with the family. They needed some support. That didn't last long. The university brought me back. Now I'm the dean for the School of Science, Technology, Engineering, and Math for all of Vermont State. But I'm here today to ask you for your support to establish a Rare Disease Advisory Council. But before I do that, I want to share a little story with you. About 10 years ago, I wanted to build a tree house for the kids with 22 DBH white ash in Jericho, lots of trees, beautiful tree, 60 feet tall. Get on the ladder, I put a board about 12 feet high up in the tree. My son's sitting over there on the grass, not moving, but he's sitting there. So, okay, that looked good. So I moved the ladder around the other side of the tree because I wanted to just get a feeling for what it would look like. And the ladder was right where I wanted to put the board. So I climbed down the ladder, but I forgot my hammer that was on top. Okay. So it hits me in the head and I got blood dripping down both sides of my face. My son on the grass is screaming, my head, my head. I'm like, Ryan, it's my head. He's like, my head, my head. Ryan, it's your foot. He goes, my foot, my foot. Like, it's okay to laugh. Okay, it's what else are you gonna do with these things? But he has no sense of if he's hurt or not. I mean, if he is hurt, I could tell him he's not hurt, and he'll say, okay. So we never know if he's hurt or not. We never know if he has a pain. He has Fragile X syndrome. So just a little bit about Fragile X. I do have these cards that I call my bad parenting excuse card that I'll hand out to you. On the back of that card is one of the QR codes is to Katie Couric. Katie Couric interviews our son's doctor, who happens to be at the UC Davis Mind Institute. There's no one here in Vermont who knows about it. And some of our dear friends in New York are interviewed on that too. So if you feel like you need to cry tonight, it's an 8-minute video. It's really well worth watching. But so he has Fragile X. He was diagnosed when he was 4 years old. I mean, we knew there was something wrong soon after birth, but we didn't know what it was. It's a blood test. It's a medical issue. It's often misdiagnosed as autism. Our daughter was 1 year old at the time, so we had a blood test, and she got Lane's other X, as you know, women have 2 X's classically, and men have an X and a Y. So we learned about Fragile X. It's based on the FMR1 gene. It stands for Fragile Mental Retardation 1. It's the leading known cause of inherited cognitive delay, as you can see in the front of this card. It's also the only known medical cause of autism. Autism, as you know, is a behavioral issue. It's based on the DSM-5, but Fragile X is a blood test or saliva test. If this Fragile X primarily is anxiety and cognitive delay, but there's also a bunch of emotional and behavioral issues associated with this, including autism, anxiety, seizures, and other issues. The gene was just discovered in 1991. We have about 25,000 genes in our body. This is one gene that doesn't work, okay? Just one gene. Again, the gene is called FMR1, Fragile Mental Retardation 1. What genes do is genes make proteins. When genes don't work, proteins aren't made. When proteins aren't made, things don't work. This Fragile X syndrome is also associated with Fragile X tremor ataxia syndrome, which is an age-related issue. It looks like Parkinson's. With Parkinson's, people might just, be shaking, but with Fragile X tremor ataxia syndrome, it's an intentional shaking. The shaking only happens when you reach for something. I mean, there are a lot of subtleties between autism and Fragile X, but Fragile X is a medical condition and is a cognitive delay, and those on the spectrum, they can be quite sharp. So it's a behavioral issue. And a secondary issue with Fragile X is called Fragile X primary ovarian insufficiency. It's related to a variety of ovarian problems, infertility, early menopause. 30 years ago, I took a leave from teaching to go to Texas to run a research project, and I met my wife on a blind date. I said, come back to Vermont with me. She's from Texas. Because it's cold up there. Lord Scott said it's cold. I said, don't worry, in 30 years of global warming, you'll be fine. Little did I know, early menopause also helped. Okay, so my wife and I are caregivers for our 23-year-old son. He doesn't communicate clearly. He lacks numerical literacy. If I have 3 pens on the table, I'll ask him how many pens are there. I'll get a number. If I ask him again, I'll get a different number. There's no one-to-one correspondence. He can't advocate for himself. He can't take care of himself. He acts on impulse. There's no thoughtful decision-making going on. He's never left alone. And we can't find appropriate medical support here in the state of Vermont. We have a hard time finding personal care assistants. My wife doesn't work because she's with him all the time. We need to find a safe place for him to live. We don't know what we're going to do about that. We have plans, and our plans change like the weather. And Fragile X is a rare disease. Yet my situation and the needs that we have are not unique to Fragile X. Many Vermonters have rare disease with similar problems. The U.S. Food and Drug Administration defines a rare disease as if there are fewer than 200,000 people in the country at any given time with that disease, it's called a rare disease. Fewer than 200,000 at any given time. And there are about 10,000 different rare diseases, which means approximately 1 in 10 people have a rare disease. Disease that we've never heard about. But 1 in 10 means 65,000 Vermonters need your help. That's a lot of people. So I'm here to ask this committee to establish a rare disease advisory council in Vermont. Representative Donahue of Northfield, right here, Dan, Representative Stone of Burlington, and introduced H46, which uses language drafted by me. A coalition of Vermont-based advocates organized with the help of Carolyn, who's behind me, to form a rare disease advisory council. This council will enable Vermont to strategically identify and address barriers that prevent Vermonters with rare diseases from obtaining proper treatment, from finding care, and learning about where they can go for support. Like, if you don't know who we are and what our needs are, how can you help us? It's like the missing link here, I think. So it's an advisory body, as you well know, but it's a platform for those who have rare diseases to have a stronger voice in state government. So again, I ask you to advance H46 through this committee so we can pass it to the House before the session break to ensure that, you know, patients and caregivers and healthcare providers, researchers and policy experts can help shape the care and support for those with rare diseases. I have I put 2 documents that are shared, 3 documents that are shared on, Lori put them on some page. One is a fact sheet for Vermont, Fragile X. It describes the different associated syndromes, but it also tells you the numbers of people who have Fragile X. These cards that I've handed out, I've only left them in one cafe ever. I always hand them out. I left them in a cafe in Johnson. Someone picked it up and said, "Oh, this looks like my son." Got tested as Fragile X. They moved from Morrisville to Jericho, where we live, because the Chittenden East Supervisory Unit has been fantastic. We've had the best IEP team forever. They've gone to conferences with us. They've let us do trainings for them. We trusted that. We trust our IEP team completely, letting them do things that we knew wouldn't work, but they wanted to try it. For example, they wanted to try ABA because it works with kids with autism. We know it doesn't work for Fragile X. It ended up that Howard team invited me to present to 50 of their autism providers to teach them how to handle and how to work with and understand what Fragile X is, because it's completely different than autism. So if you're interested, this one's about Fragile X in Vermont. I'm not here to advocate for Fragile X, support for Fragile X. That's a different question, a different need, different ask, but I'm here to talk about the fact that in New England, notice that Vermont's the only, I wouldn't want to say white state, but the one that's not color orange. Okay. So there's some information about there's some information about what a rare disease advisory council is. And I also included in that document a picture of our family.
Oh.
4 of us. And so thank you for your time. If I can help you in any way, you need university support or anything like that. But do let me know if I can answer any questions. Do you have any questions now?
I have one. I'm just curious, one, if you have any particular thoughts about whether a rare disease advisory council, and you heard the deputy commissioner at the health department say we don't really have the capacity to do this right now. And we had some very brief discussion about whether university affiliated, we have a medical school here. If that, do you have any opinion about one way or the other?
I think that the way to make change is through government, through politics. It's through legislation. It's not standing in the streets, and it's not getting other people to do things. So I think if we want to be effective, I'd like to see something happen here at the State House with leadership from the State House.
Well, I understand that piece about in terms of passing the bill, but if we were to locate the council at the university as opposed to being at the government, health department. Are you saying that you'd prefer to see it at the health department versus the university?
I would.
Okay.
And because I think that if the Rare Disease Advisory Council is more closely connected to legislation and the legislators, then we can be more effective and find out more. I think things get, not biased, I'll say biased by outside agencies. They tend to have their own focus. And I think I'd like to see a more statewide control over that.
Thank you.
Anything will help.
Right, right. I appreciate that. Yeah, go ahead, Representative Cole.
Thank you so much. I'm wondering if your family has any experience with the Children in Special Health Needs Network that the Vermont Department of Health is.
We do, we work with them. My wife's been on the board of the Vermont Family Network for 10 years. We work with every agency that we know of, and we reach out a lot. So
And-
yes.
I'm curious, with that experience, like good things that have come from that, or maybe gaps you think need to be filled.
Right. So that I'd have to think about and get
Sure.
back to you about.
Yeah.
Mostly in our case, because this medical issue, Fragile X, is not understood by people, it's hard to get the right guidance. And people that have come and we've worked with over time, want to apply what they know and often aren't willing to learn more.
Mhm.
So, Kirsten Murphy is with the
DD Council.
DD Council. She's been great help. We've got a lot of guidance from them, from Vermont Family Network, more than the organization that you mentioned.
Mhm. Thank you.
But we do reach out and contact everyone all the time.
Definitely.
Any other questions? Thank you so much for being
Thank you for
here.
your time.
Appreciate it very much.
Thank you.
No witnesses, Lori?
Somebody will send the door.
Yeah. Okay, will you check? Barry, thank you.
Can you tell me your name again so I can get back to you on that?
Oh, sure. Esme Cole.
Okay.
Thank you.
Hi, welcome.
Bye.
I'm sorry, I don't hear your name. Katie. Katie, thank you.
Thank you again.
All right, thank you. Okay, Katie, so we are have moved from being behind schedule to being on time. So welcome.
Thank you. You want me to sit?
Yes, right there. He's warmed it all up for you. Thank you for being here. We'll just do a brief round of introductions. So I'm Teresa Wood. I live in Waterbury, and I also serve Bolton, Buell, Score, and Huntington.
Ann Donahue from Northfield, also Berlin.
Good morning, Representative Barrett, Rutland City.
Hi, Doug Bishop from Colchester, Chittenden 20.
Todd Nielsen, I represent Brandon Flower Cars, yeah. Good morning. My name is Son Eastis. I live in Guilford and represent Vernon as well.
Hi, I'm Esme Cole representing Hartford.
I'm Julie McGill from Bridport, and I also represent Middlebury, New Haven, and Woodbridge.
Hi, I'm Ray Garofano. I live in Essex and I also represent Essex.
I am Lori, committee assistant.
Natalie Wild from Health. Jessica Chanel, Department of Health.
And welcome.
Thank you.
Introduce yourself, and we're happy to have you here.
Fix this little smudge.
Oh, sure.
I'm Katie Pocket. I'm from Essex, and I have a testimony to read that will tell you a little
Yes,
bit
that'd be
more.
great.
And thanks for having me. Okay. I'm glad the weather was a little bit nicer today. So hello, I am Katie Paquette from Essex, Vermont. I am here today as a patient and an advocate and to ask you for your help for H46, which would establish a rare disease advisory council in the state of Vermont. I am both a rare and complex patient with Ehlers-Danlos, Sjogren's syndrome, and fibromyalgia. If you look up Sjogren's, it may only say it causes dry eyes and mouth, but it is important for people to understand the complications that come with this disease and that it can vary for each person. Mine has progressed and the symptoms can be so scary. I am speaking out today because I'm someone who has always been afraid to speak up, but after living with a rare and chronic illnesses, I need to make sure I can be a voice for those who are too afraid to speak up, because not only can it be terrifying, but it can also be incredibly lonely. I never imagined my life would be filled with doctor's appointments, physical therapy, and procedures, but it is. I know I look healthy, but I live in constant pain with flare-ups and added anxiety. When I mention the loneliness of living with rare diseases, I am speaking for thousands of Vermonters who feel the same way. Many of us have conditions so rare that we might be the only person in our community with a diagnosis. A rare disease advisory council would create a dedicated place where our voices can come together and our collective experiences can inform policy and build a true community for those who often feel invisible in the healthcare system. This is not only about having a voice in government, it's about creating connections between patients, families, healthcare providers, and researchers who are otherwise disconnected across our state. A rare disease advisory council would provide a way for patients like me to have a voice in state government and inform state leaders about these challenges to create potential solutions. The timing of this bill is especially critical now. The recent termination of the Federal Advisory Committee on Heritable Disorders in Newborns and Children has created a serious gap in oversight for early detection programs that identify approximately 14,000 babies with serious conditions each year. Here in Vermont, we need our own council to help fill this void and ensure our state's newborn screening program continues to advance. H46 explicitly tasks the council with developing policy recommendations to improve Vermont's newborn screening program. As someone who knows firsthand how life-changing an earlier diagnosis could have been, I see this as one of the most vital functions of the proposed council. I am asking you to please support H46 to ensure that people living with rare diseases in Vermont have a voice in state policy. Thank you for your time and dedication to this issue. Together we are stronger. Thank you.
Thank you. You did it. That's good. Thank you so much for being here and for working through, public speaking's not easy for lots of people. So you did great. So people have questions for this witness. Yes, go ahead, Representative Cole.
Thank you so much. I appreciate your courage and thanks for telling your story. You mentioned at the end there about how an early diagnosis would have been really life-changing for you. And I am curious if you're up for sharing.
Well, I am adopted too, and I have EDS, and now I wasn't diagnosed with EDS till I was older, but there's a lot of I really need to go through more genetic testing to find out if I have other forms of EDS. So I've ruled out vascular, but that's it. But it's so complex. And then I have like Sjogren's on top of it. So I have connective tissue, autoimmune disease. It's made my life really challenging. But if I had known when I was a child, I had some sensory issues. I had stomach issues. My coordination was off. I'm like, why can't I run? My joints would dislocate. I remember being a child and I would have temper tantrums and I would dislocate my elbow and my mom would bring me to the doctor and that wouldn't fly anymore. They'd be like, why is her elbow constantly out of joint? And even now, like I can't run downstairs because it'll just be like, and sometimes it pops back and Sometimes it doesn't, sometimes, but that would have been, I felt like a crazy person. And people were like, oh, she's really weak and like kind of pathetic. And it was hard. And I had some like brain fog. And it turns out all of this stuff is connected. And learning disabilities growing up. Like I was told I had learning disabilities, and apparently that's also tied into EDS. And then school is really hard for me because they're like, you have learning disabilities, but no one actually diagnosed me with anything until I went through the Stern Center as an adult to find out for myself what was going on in my brain. It's been a long journey, and the earlier people can find out what's wrong with their bodies, it's definitely better. And babies and children, it's so important. And especially if it's genetic, especially if a child's adopted, like I didn't know anything until I was older and could find out some information about one parent. So it was really hard to grow up not knowing. And everyone just thought I was kind of a freak. A whiny little baby.
That must have been difficult for you. Yeah.
It was. And because of the way I was built, people were like, oh, you must be really good at basketball. And I can't believe people still ask me if I played basketball. I'm like, no, like I was a horrible sports player.
Representative, go ahead.
Thank you for sharing. I'm curious if there's anything you could share about how you became connected with the community of individuals in Vermont who are talking about and advocating on behalf of rare disease.
So I actually got involved with NORD through Sharon Radke. She's another member of NORD. We're both members of the Milton Artists Guild, and she has a rare disorder. And I told her that I felt like mine was more complex than really, EDS. There's a whole umbrella under that. Mine is more common now, but back in the day, people didn't know what that was. And there's still a difference between, is this person just hypermobile or do they have Ehlers-Danlos? So mine was confirmed Ehlers-Danlos, which means like your skin is stretchy and there's all this weird, like you bruise easily and just very bizarre things. And I'm like, oh, that's why I'm so clumsy. There's a wall, I'm bound to walk into it. I'm just somehow going to find it, my life has been very challenging, but I have always powered through. And if I can be a voice for others, that is huge, especially because I was so painfully shy as a child. I did not speak. I didn't even start talking until I was like 2 years old. And so, this is really important.
Thank you.
Thank you.
Yeah.
So I know you know to know your skills.
Yeah.
I'm a dog lady.
Oh, really? Oh, nice. That's awesome.
Never know when there's a connection, right?
know.
Yeah.
I'm going, I know her. Oh,
Yeah.
I'll say if I miss.
Yeah, definitely.
Any other questions? Thank you so much for being here. We really appreciate you sharing your story and being here to testify. Are you Sarah? I was thinking you were. No, it's all good. I remember you from before. Welcome back.
Thank you. I do have copies, the testimony that I wrote, and I did email a copy to the clerk.
Okay.
And pass them around.
Okay. Did you submit your written testimony to Lori?
Is it the same?
No, I added in.
Yeah.
So if you want to just email me, sure.
That'd be great. Thank you so much. Thanks. Nice to see you again.
Do you want me to just go ahead and read this?
Whatever you would like to do. Floor is yours.
Thank you. Good morning, and thank you so much for the invitation and opportunity to be here again. My name is Sarah Elliott, and I'm a constituent from Glover, Vermont. I appreciate coming back to talk more about the establishment of the Rare Disease Advisory Council, Bill H46, and what it means for patients, Katie and everyone else that's on this call. When I was here last, I stated that dwarfism, the rare disorder that I have, is not something to be cured or fixed necessarily, but that treatments are necessary in some cases. There are some needs for medical interventions. There currently are interventions like growth hormone therapy and surgical procedures that can influence growth in individuals with dwarfism, if the family chooses that as an option. There are people advocating on both sides of this. It can be pretty complicated. There are some, for the treatments which reduce the medical complications that could begin occurring in childhood, like sleep apnea, spinal stenosis, or these things may not show up until later in adulthood. It's going to depend on the type of dwarfism that you have. Some believe that these treatments are unnecessary, kind of related to taking away from the self-acceptance and bigger issues like inaccessibility of spaces and society's view, including discrimination against individuals with dwarfism. Either way, quality information should be available to anybody that wants it. I was born with a milder form of dystrophic dysplasia and was not correctly diagnosed until adulthood. Once again, children with dwarfism are often born to average height parents, meaning that you may have no family history and then the gene presents itself. Often skeletal dysplasia is detected in utero, but often not present until birth, and again, maybe sometimes later into childhood. There's nothing for me personally that could have been done differently if I would have had that correct diagnosis. The treatments I had for my clubbed feet would have still been the treatments for clubbed feet. But with the termination of the Advisory Committee on Heritable Disorders in Newborns and Children, having a state-level committee to support rare disease patients in both identification and management of their disorder is a tremendous public health and human service-related need. The RDAC's influence would not just end with medical care either. The quality of life could be addressed, including housing, transportation, and access to community resources and more. It is quite difficult to find resources in Vermont simply because there's not a large population of individuals with dwarfism here. The information is just not available. We're also small, rural, and secluded, which makes living with a rare disorder even more difficult, as other people have explained how lonely and isolating it is to have a rare disorder in these communities. Combined with the stigma that people with dwarfism face, being mocked and humiliated in public just for being in spaces you are visiting or shopping in, it can be very isolating, often leading to depression or even suicide. I was once called an Oompa Loompa by a student when I was an educator, and it comes down to people not knowing any better. And there's a need for advocates like myself and these other advocates to continue to educate our community whenever we have the opportunity. The RDAC could further support these efforts, leading to better outcomes in life for people with dwarfism and other rare disorders. Once again, I just respectfully ask for your support in voting yes or aye when it comes your time to cast the vote, ensuring the voices of rare patients are heard in state policy decisions for generations to come. Thank you so much for your time and for your service to our students. And if you have any questions, I'm open to questions.
Thank you, Sarah. Appreciate it. You're getting claps from Carolyn behind you.
Oh, that's cute.
So we heard testimony a little while ago from the health department about essentially their thoughts about with looming federal cuts, not knowing so much uncertainty actually at the health department right now, that it would be difficult for them to take on this, although they would appreciate participating in it if it were housed someplace else. And so one of the thoughts that sort of got thrown out there is whether or not the university might be willing to host the advisory council. And I'm just wondering what your thoughts are about that. And apparently from looking at the map that was shared with us, it does exist in some universities. Similar councils exist in some universities across the country. And so I'm just wondering about your thoughts.
University of Vermont.
That's where it would be. Yeah, I mean, that's where we would propose, just since it's got the medical school.
Yeah, I actually attended the University of Vermont for a year when I first started. I think it's wonderful wherever there would be the space to house this. I definitely understand the cuts that are happening, but like those cuts are also impacting the patients with rare disorders. So not having our voices being heard and then cutting our money is just kind of saying like, well, we're sorry that you exist, but we can't really help you. So that's difficult to hear. But if there is other avenues for that to be able to be like, here's an opportunity, like the university could take us on, then that would be wonderful.
Yeah, I mean, we don't know if they're willing. That's a very new idea.
Right, I'm sure this is happening really fast. Like a lot of things happen so fast. So
Yeah.
that's.
I think that, we definitely understand, as a couple of witnesses have talked about, the elimination of, several resources by the federal administration that impact people with rare diseases is troubling. And like you said, for potential small amounts of investment, we can at least elevate the voices of individuals, hopefully. So we'll see what happens, but appreciate that. Other questions for Sarah? Thank you. And it's nice to see you again. We appreciate your testimony. Oh, and we do have Suzette.
Hi, everyone.
Suzette, welcome.
Hello. Thank you. Hopefully you can see my screen. You may not be able to, but
not yet. It's just black.
Sometimes it's not, sometimes the connectivity here isn't the greatest. So
that's okay. We can hear you loud and clear. So
great.
We're glad to have you this morning, and the floor is yours.
Excellent. Well, thank you so much. I have a few things to say. I grew up in Vermont in the Northeast Kingdom. I'm currently in California, but I have 2 children with Batten disease, late onset CLN2, which is an extremely rarer than rare disease. They have been receiving treatment through an enzyme therapy for 9 years. And I can tell you that the devastating news when it was delivered to us and we didn't wait as long as most people do, unfortunately, in the rare disease world, because of exome sequencing. We only waited 1 year to get a diagnosis. But this is an extremely devastating disease that takes everything from your child. Think of Parkinson's meets Alzheimer's meets ALS. And it's fast and it's brutal. And no human being should have to live through this, especially a child. So we were obviously devastated. And when we received the news from our doctor, and this is why it is so extremely critical to have organizations at the legislative level that can help parents and help these children, quite frankly. Our doctor said to us, this is rarer than rare, so I suggest that you get a binder and you put every single medical piece of information that you ever get about Maya, because you're now on an odyssey, and you will know very quickly more about this disease than I, as your neurologist, will. So it is not only are you getting this devastating news, but then you're hearing that no one knows anything about it. And then when you get farther down, once you've kind of somewhat got your footing, even though I don't think you ever really do. I mean, Maya is now 22. She's been living with this disease since she was 9 or 10. I mean, her whole life, but it didn't really show until 9 or 10. And her brother as well. It has been an extremely, it's been a process that parents have to go to the mat. It takes everything. I mean, I was interviewed once, and that's what I said. I said, this disease takes everything, not just from the child, but from the family and the parents. And it has a long-standing ripple effect on everyone, excuse me, that this disease touches. And so to be in this place where you've received the worst news of your life and here you go, get a binder with no one behind you is really cruel. So, yeah, that's really in a nutshell what it's all about, is to have that support. And, we've had so many instances with Batten disease, specifically with CLN2, where, we've had gene therapy that's been ready for years. Now, COVID put a little bit of a wrench in that, but not much, honestly. Because as a parent, you work closely with industry, you work closely with whoever you can at the government. Because, by the way, rare disease is held to the same standard that a disease as large as like Alzheimer's would be, right? When they go through treatments and therapies, they typically have to use the same process, and it takes a very long time. For example, placebo, right? They're trying to put that back in place. And with rare disease, to have a placebo is really even more of a death sentence, right? When you're doing a trial. But the issue with, needing help from government is from legislature is really to help us treat rare diseases, children or adults, because now my children are, my daughter is an adult now. She went through all of her childhood with this, is to really help parents and the industry move this along, so that our children do have better treatments, more treatments. Not every treatment works for every person. So we need a multitude of them. And to get it through the FDA has been an absolute nightmare. And it hasn't. It's still, I think they probably just now received IND to move forward. But, that's after we can be as critical as we want about the pharma companies, but, these guys stayed in it for as long as they possibly could. Like, they can't continue to have to go back to the drawing board each time because the goalpost changes, correct? The goalpost for trial readiness has changed because they've either had turnover or they're, the way in which they're looking at these things aren't standardized, et cetera, et cetera. So anyway, that's why we need legislation to help us for sure.
Suzette, I'm just curious. So because the disease that your children have is so rare, did you find that you needed to move in order to receive any care and support that was going to be helpful to your family?
I'll give you the flip of that. My whole life, growing up in the Northeast Kingdom, I couldn't wait to get out. Not gonna lie, right? I wish you could see my face. I'm sorry that you can't see me. Right? I dreamed of big cities and, et cetera, et cetera. Now all I dream about is getting back. But the problem is, it would be very difficult for us to, it would be more challenging. I'm not saying that we're not looking at real estate every day and dreaming and et cetera, but it definitely does factor into the equation. And if I didn't have the support, I would move for sure. But it does factor into my equation of moving back.
Thank you. Go ahead, Representative Steady.
I'm kind of along the same lines as my chair. So in California, they already have these bills in place for people with rare diseases, and the support services are already in place in California.
Yes.
Okay.
Yes. I mean, there's still a lot of work that needs to be done within them. But I know Vermont, when they do something, they do it right, quite frankly.
Thank you.
Thank
You're
you.
welcome.
Other questions for Suzette? This time? Thank you so much for being here and sharing your story, Suzette.
Thank
We-
you. I
We
appreciate
hope
it.
that you're able to return to Vermont at some point in the future.
We're working on it.
Alrighty.
Thank you, everyone.
Alrighty.
Thank you.
Bye.
Okay. So we haven't heard from Heidi or Karen. Okay. Heidi's a no. Okay. Okay, folks, so we have folks coming back at 10:45, so we will